performed this bone augmentation?
Well, I did sinus lifts, of course, in the beginning of my career, and I did the last sinus lift in 1997. And since then, it was not necessary. I found technologies how to avoid this thing. Sinus lifts are operations where the maxillary sinus is made smaller, and so kind of bone substitute material is put into the maxillary sinus, and then this should turn into bone, or it should become like a mixture of bone and this material. There are resorbable materials and there are non-resorbable materials, all kinds of materials like algae, bone from dead cows, even bone from dead humans. I mean, all kind of stuff is being thrown into the maxillary sinus. I mean, you will not believe it what they do, and they hope and pray that this turns into bone, and then they can plant the implants. Now, luckily, even if it doesn't turn into bone, two-stage implantology to some extent works. I mean, there are a lot more successful cases of implant placed in this augmented bone material than successful bone augmentation. So if you look at the panoramic picture after bone augmentation, let's say after half a year or a year, you see this material, but you don't see if it's successful. But obviously it doesn't matter too much unless it's actively infected. It doesn't matter if this really has turned into bone. This is what we know today, and actually the smallest amount of this bone augmentation has really been turned into bone, but nevertheless this lifts the membrane. This gives a little bit more vertical during the surgery for the implant. Longer implants can be used, and there is of course the bleeding induced, and from this bleeding woven bone can be generated. I mean, talking about the bleeding during implant placement, after the bone augmentation has healed. And this gives another chance for the implant to be successful. But the bone augmentations by themselves are by far not as successful as we are made to think.
Okay, I ask a question that also maybe like the same we discussed before, but for this it's okay. If we have some teeth, they are okay. For example, just 2 teeth that patient wants to save, but the whole jaw, all the teeth are in the bad condition. Can we save it?
Well, if the patient wants to live with the teeth, then I mean, probably better to go to the dentist, not to the implantologist. We are the people, we make teeth, without natural teeth. Although, let's say at the age of 50, single teeth may be, let's say, good, but still they are 40 years in the mouth and they have their history. So very few teeth are going to be good forever. Single teeth or 2-3 good teeth in a jaw is not giving any advantage to the construction. Simply they are there. They are, I don't know, maybe even free of charge there. Maybe this is what patients think, and I have them, so it's free of charge, I keep them. And the implants I have to pay. But I recommend not to connect implants and teeth, I mean in prosthetic constructions, and I recommend to take the teeth out. The point is that implants are either osseo-fixated or osseo-integrated, so they become one unit with the bone. So this is a very rigid connection to the bone. So it means also whatever the bone does. So if the bone grows up or shrinks or changes its spatial position, the implants will follow. And teeth are different. Teeth don't follow the bone. They have nothing to do with the bone. So they are not elastically, but they are in some fibers, and the direction of the tooth can change. It can tilt. It can elongate. It can intrude. So teeth are not even close to don't even have close the connection to the bone like implants have. So implants basically belong into the bone, and this becomes one functional unit, and nothing will destroy this unit.